If you look at the mechanisms of how stem cells work, and I think that's the bottom line, you have to look at the functions of stem cells. The huge part is anti-inflammatory. So mesenchymal stem cells has been demonstrated incredible anti-inflammatory effect. And as you know, diseases, chronic illnesses,
inflammation is the word.
Right, or aging process is all tied to inflammation. So when you can calm the inflammation, you can really allow the body to go into the regenerative process. I actually think stem cell therapy is a form of energy therapy. It's not. We're not injecting molecules. It's not a pharmacological. It's energetic because I'm injecting DNA. And the DNA with its intelligence is sending signals through that intelligence. So intelligence is a form of energy, right? So
wow.
It's the first time in human history that I'm injecting intelligence into the body,
back into the body
of my patients.
Wow, that kind of like blows my mind a little bit, to be 100% honest. That's so incredible. Almost every day in practice, I get asked about stem cells. People want to know what they are, where to get them, and honestly, so many of you are traveling all over the world to get stem cells. I want to get educated on this topic too, and that's why I invited my next guest. Please meet Dr. Joy Kong, who is a triple board certified anti-aging physician and a stem cell specialist. She's renowned for her expertise in stem cell therapy and a commitment to educating both physicians like me and the public. With a strong presence in the industry, she has established herself as a trusted voice through her extensive lecturing at national and international conferences, as well as her publications in scientific journals. Please welcome Dr. Kong. So what's going on? I feel like the stem cell thing came at me out of nowhere. What's happening? What are stem cells? You know, how did you get into stem cells?
Right.
Give us a little peek into all of that.
So I got bitten by the stem cell bug about 8 years ago. So I was like every other doctor, having no awareness of what's going on in the real world when it comes to stem cells. Because in medical school, all we were taught was that there were stem cells and you can use them and there's research going on. That's all I knew.
End of story.
So I was actually a psychiatrist. So after residency, I was practicing for 7 years. And I knew what I knew, which did not include stem cells, until I met this doctor at the end of like an addiction training. And he said, hey, you know, I'm a anesthesiologist, but I use stem cells. I do anti-aging medicine. I was like, really? What's anti-aging medicine? And what? You're using stem cells?
Right.
I thought they're doing research.
Right.
What's going on? So that was really interesting. That shows you how even somebody like me, who's really open to integrated medicine, Eastern, Western integration, still, I had no idea that people are actually conducting stem cell therapy already in this country.
And that was 8 years ago.
That was 8 years ago.
Right.
So
okay.
What he told me was, look at what happened with this autistic kid. I give him umbilical cord stem cells and look at all these changes that the teacher have noted down, about 40 different changes, behavioral, you know,
learning
accomplishments in school, etc. And those are the things I could not make much of a difference in, even though I was a psychiatrist.
Right.
We were trained in treating autism. So that was mind-blowing to me because, you know, unfortunately, a lot of doctors these days are not curious enough. If their patient got better because of stem cell treatment, they're just like, oh, whatever, or whatever alternative treatment.
Right.
They're still brushing it off as one-off. But to me, that was a turning point because there's something I didn't know that's so powerful that if I don't tap into it, then I'm not doing my patients justice. So when I saw what he did for the autistic kid, even though he wasn't trained in autism, that's when I realized, okay, I need to dig into this. I need to find out what kind of research are done and what kind of evidence, how does it even work? Why did it help this kid that I don't know how to help?
That's amazing. I didn't even, you know, this is my ignorance again, but I didn't realize stem cells were being used for conditions like autism. I was thinking about it more, or at least in my head, it was more about like anti-aging maybe or longevity type stuff. I didn't realize it's being used very condition specifically.
Oh my goodness. And that's the whole point of me setting up American Academy of Integrative Cell Therapy when I teach doctors.
Yeah.
We have like over 30 categories of organ systems and disease categories from head to toe.
Wow. Wait,
from
you set
skin.
this organization up?
Yes.
Okay, tell us about the organization.
If people are interested, just look up aaict.org.
Okay.
So that's the American Academy of Integrative Cell Therapy, is about providing cell therapy and teaching doctors how to do it, but also doing it under the kind of philosophy of respecting the body as a very complex whole. So we're not just, stem cell therapy is end all be all. No, we're doing it in a complex web of relationship that's called the biology of the human body.
So important, because even like if you look at the HRT community, it's like HRT for all, hormone replacement therapy. But you have to look at it holistically. Yeah. Otherwise you can do more harm than good.
I think is arrogance if we only say, my method is fantastic, this is what everybody should do.
Right.
Okay, yeah, maybe for most people it's going to be amazing, but for some, they may need something else. Stem cells can help everybody. That's not a question. But there may not be enough benefit for some people if they have a lot of underlying toxicity, maybe infection, hidden infection. If you don't address those, or if their microbiome is completely out of whack, right? You need to adjust your nutrition. They don't have enough vitamins or minerals, then they can't really get to the place you want them to be. So that's why you have to address everything.
Everything.
Yeah.
It's all connected. We say that all the time.
Yeah, but the thing is that from head to toe, in
incredible.
our clinic, 90% of our patients actually are coming in for severe and devastating condition. So it could be from autism, from dementia, autoimmune conditions, all kinds of brain issues, traumatic brain injury, ALS, Parkinson's. It can be internal organ issues, heart, lung, kidneys, liver,
all of it.
Just testicles, so, really throughout the body. Musculoskeletal is the bread and butter of stem cell therapy. That's what people know most about, right? Kobe Bryant, going overseas. But anti-aging is a small portion. Maybe somehow it
got the most buzz,
got loud,
got the most buzz.
It is a really important part, because my goal really is people can get various modalities incorporated so they don't get sick, right? So they start to do things that really can enhance their health. And stem cell therapy is a powerful tool, so you can keep your body functioning at a younger state, so you never get to the decline, which is the precursor of disease.
Interesting. So let's start with some basics. 101. What is a stem cell?
A stem cell is a primitive cell that has the capability to replicate itself, but also make a copy of itself that's a little different, that can replenish tissue. So if we go back to the very beginning, I always like the very beginning, the history, which is the fertilized egg. So both you and me, as amazing and complex as we are,
we're eggs.
We came from a single cell.
Right.
And what the hell's going on in that single cell? How did it know to become a full-fledged human with such complex organ systems, all talking to each other? Somehow we are all walking, talking, generating thoughts. I mean, it's a miracle, right?
Very much.
So what was in that cell? And that's what we're tapping into. That first cell contained this DNA, right? The DNA is the blueprint for life. It's the most energy-dense substance in the universe. And what is energy and what's intelligence? Are they intertwined? Do we know the answer? Not exactly, but you can imagine if there's information, probably that's what where the energy is contained in, right? The information, this power that's within this capability to respond to the environment, to generate changes. So that's what we're tapping into. So the fertilized egg is the first stem cell, and from there downward, you start to form different structures, right? The embryology, the different layers.
Taking me back,
remember.
yes.
It's a complex process. I
think I did okay on that test.
I
think so. I'm trying to remember now.
It's a pain.
It was a pain.
Right. It's very complex. So when you start to develop different organs, there's a process, right? You go down the developmental pathway to gain specialization, and you lose capacity. So when you're very young, early stem cells, you can become anything. The embryonic stem cells, or when we talk about embryonic stem cell therapy, is really the cells that's in the inner cell mass, in day 5 to 7 of the embryo formation. So inside the embryo, there are all these cells that you can obtain, and each can form a full-fledged human being, right? So they're that potent. But as they develop, they start to lose the capability to become anything. But then they gain function. So they're gaining, let's say heart. They start to go toward the pathway of the heart until they reach the end stage of a stem cell, which is a tissue-specific stem cell. In your heart, you have heart-specific stem cells. So that's at the very, very end of the stem cell pathway. And from there on,
embryonic stem cells, which are from the beginning.
Yes.
Then you have
different
stem cells.
germ layers that each can develop into different stem cell lines.
Gotcha. Right? And then you have tissue-specific stem cells.
Right. So in
three
each of your organ
types, basically.
Exactly.
Okay. Gotcha.
So each of your organ already have stem cells that can regenerate cells in that organ. And this is the premise of how we're doing stem cell therapy right now. We're really not giving you a organ-specific stem cells, and we may not need to, because by giving you something called the mesenchymal stem cell, we're actually able to send signals to your own tissue-specific stem cells so they can replenish the tissue.
So it's like a commander-in-chief
exactly
now being able to direct somebody further down the road.
Exactly.
Because they have the resources and the energy to do so.
They have the information.
And the information.
Yeah.
Gotcha.
It's like blasting your body with clear instructions.
Oh,
and a lot of times as we age,
miracle.
It is a miracle. That's why it's so incredible. It's so
exciting,
fun. And I see it in practice that it actually works. So what's really interesting is, when we were born, these mesenchymal stem cells, this is one type of stem cells, but they're very powerful because they're strategically positioned in every part of your body. So anywhere you have blood vessels, blood supply, these cells are hovering, they're holding on to your blood vessels like a gecko, holding on to a wall, and they will sense what's going through your blood vessels, and then they will also sense what's going on in the neighborhood, in the tissue. So they also they have their hands on the local tissue-specific stem cells. So they're like hearing what's going on in the blood, and then they're sensing what you need in the tissue. Sometimes they can send signals into the blood, so your entire system, your immune system, can respond. It's like gathering an army, sending out this rescue signal. So your immune system will send what's necessary to help local repair. But at the same time, if there's an area that is screaming of injury or inflammation, those signals will be floating through the blood, and the stem cells can sense it. So these mesenchymal stem cells, when they sense these strong signals, they can squeeze themselves into the blood vessel and actually swim upstream to find the signal. Once they find the highest density of the signal, they will squeeze themselves out, and then they can
do their thing,
produce all their signals to tell local cells what to do, but also send signals into the blood.
Fascinating.
That's why mesenchymal stem cells are so powerful. And what's interesting is the number of stem cells, these mesenchymal stem cells, I'll just call MSCs for short, the number decline as we age. When we were born, you had 1 in 10,000 cells as MSCs. But by the time you're a teenager, it's already down to 1 in 100,000, right? You have 1/10 as far as proportion of number of cells. And by the time you reach your 40s, is 1 in 400,000. By the time you reach your 80s, is 1 in 2 million. So no wonder people are wrinkling and their organ functions are declining. They can't repair as fast. That's why they have osteoarthritis. You think it's a wear and tear disease? Just look at the little kids, how much they are wearing and tearing their body. Nobody is having osteoarthritis. Right. So
absolutely.
It's a degenerative inflammatory condition because your body cannot keep up with the repair, because you're just running out of good signals.
I love that. I hope everybody heard that. Aging is a degenerative inflammatory condition due to lack of the ability to repair. I think that's a really different way to think about aging. And I think that's almost a hopeful way to think about aging, because we can improve the way we repair and we can reverse inflammation. Those things are definitely possible. So when it comes to actual use of stem cells, in clinical practice. What has the history of that been? Has it been used or known about for a while, but was just kind of hush hush? Was it used in other systems of medicine or other countries? What's the background, before we jump into how it's being actually used today?
Mm-hmm. Yeah. The very first stem cell transplant really was the first bone marrow transplant. That was, I think, is the right around 1960s. So right at the transition point. So people did not know that they were transplanting stem cells. They thought there's something really important in the bone marrow. That one person needs, there's good things in the bone marrow.
Right.
That's all they knew.
Yeah.
And then they realized, there are these blood forming units from the bone marrow. So there are hematopoietic progenitor cells. There are all these immune cells, very primitive immune cells. So the bone marrow was the very first one. And that's one reason that bone marrow stem cell treatments was kind of the almost like the standard for some time. Mm-hmm. That's why there are still so many doctors doing it, even though later on we discovered other types of therapy that possibly are better, are superior, such as birth tissue derived stem cells. Especially if you are looking at transplanting between two people. Within the same person, some people may say, well, I want my own stem cells. But still, your own stem cells have declined as far as quality compared to the umbilical cord in the newborn, because in the newborn, the cord is really much younger than the baby's stem cell. So you're not just getting the baby's stem cell. You're actually getting what's in between the embryonic stem cell, the first egg, fertilized egg, and the baby. So they're in between in their characteristics. When you look at cellular markers, they have a lot of the embryonic markers that have disappeared in the baby's stem cells. Gotcha. So these are a very special group. So as far as the umbilical cord stem cells that have been used probably only in the last 20 years or so.
Okay.
Yeah, so that's fairly new. The fat-derived stem cells was a little bit earlier than the birth tissue-derived stem cells. That's why they're popular. They're really not getting cells from the fat, right? They're getting the cells from the blood vessels that's supplying the fat. That's why they were spinning, they were processing them to free these cells up that they were trapped in the matrix that's in the fat, but they were really along the blood vessels. So these are the mesenchymal stem cells.
So there's been some controversy around, acquiring stem cells, stem cell harvesting, cleanliness of stem cells in that harvesting process. Can you talk to us a little bit about that? Like what is the controversy? And then how are we getting stem cells that we're using today? How do we know we have a good quality stem cell versus not? And for somebody who's listening and is interested in stem cell therapy as a consumer, what should they be thinking about or looking for as well?
Yeah, so I always say there are only two things that matter in stem cell therapy. One is the cells, and the other is where to put it. So one is the original healing factor. The second is the art of how to provide that healing. So the quality of stem cell is paramount. So if you are looking at your own stem cells, maybe it's not as potent as the younger birth tissue stem cells. But if we're just looking at birth tissue stem cells, still, I think you're maybe alluding to incident that happened a few years back.
What was in the politics too? It became a campaign issue around stem cell therapy and birth harvesting of stem cells and stuff like that. So just wondering what that's all about,
So first of all, there shouldn't be controversy to harvest stem cells from the tissue that's usually thrown away after birth.
Right.
So
we don't do anything with the umbilical cord. So yeah.
Right. So and the baby's healthy. We don't try to get anybody to abort. Right. In the U.S., we only obtain the tissue after a live healthy baby is born.
Right.
They clamp the cord. Usually they just throw it away. But now we have an option to give to the mother. Do you want to save it for your baby, or do you want to donate it? So most of the time they actually choose to donate because they don't want to spend the money to keep the tissue and etc. So when you have these birth tissue and there are all these companies that want to extract these incredible cells from the tissue, and it's like a gold mine. People are jumping. It's like a gold rush.
Yeah. The new Western gold rush, right?
Exactly.
Stem cells.
So, and I see all kinds of actors jumping in. A lot of businessmen, I've nothing against businessmen. I'm a businesswoman myself. However, the priority of why you're doing it needs to be to bring good,
yes,
and for healing, and to give people the best possible, right? But that's one thing I saw as lacking. That's why I started my own stem cell company, because I realized that a lot of these people have their priority wrong, that they will cut corners and sacrifice quality and sacrifice just the scientific the composition of the product in order to gain more profit. So one of the companies, they were trying to, the demand was high.
Right.
So they were selling a lot, and they weren't really keeping up with what's necessary, which is the sterility of a product. That's really the basics, right? You're giving a human anything, whatever, drugs, supplements, you want to have something that's pure. You don't want to give people contaminated substance. So what they did was that they actually did not go through testing, because they cut corners. Usually after the cells are separated from the tissue, you're supposed to send it to third-party sterility lab. And it takes 2 weeks for the results to come back, because they were supposed to grow the cells to see if any bacteria would grow, any endotoxins would be secreted.
Yeah.
So they didn't do that, and they just started selling. And it turned out that they were contaminated with E. coli, and a lot of people got hospitalized. So that's unfortunate. However, it will be unfair to shut or to shoot down a whole industry just because they're bad players, right?
Right.
Let's say something's really good for your health. Let's say vitamin C.
Right.
And there's one company that did something that's really bad and contaminated the product. You don't shut entire vitamin C, right? Same thing as if the doctor is not doing something right in stem cell therapy, you don't say that we shut down the stem cell therapy. Just like if a surgeon did something bad for knee replacement, and the person suffered a lot, you don't shut down. You don't say we should ban knee replacement, right? So same philosophy. So unfortunately, that's one example, and I've seen some companies cut corners as well. But I think majority of them are trying
to do the right thing.
Yeah.
Well, how do you know who's trying to do the right thing and who's not?
So how do we know which company is good?
Yeah. How do you?
That is tough. So I work with various laboratories, and I personally inspect them, and I really validate what their products contain. But for a layperson or for just regular doctors who want to use the product, and everyone says they have the best product, so it becomes difficult.
Well, it's the key. It sounds like the key though is look for companies that have done testing, that have submitted themselves for testing. That sounds like something everybody can at least ask. Like what type of third-party testing have you done? So okay, so we have this industry now, or this option of stem cell and stem cell therapy. Maybe talk through, while we're still in just kind of the mechanics of it, like how's it done? Is it injected in the blood? Is it the same thing as like PRP and exosomes? Is it, put on topically? Like how are we actually doing this?
Yeah. So now you're talking about the art.
Yes. Now this is the art part. First
cells.
It was the product. Now it's the art.
So now you have to look at what are you trying to target.
Okay.
So if you look at the mechanisms of how stem cells work, and I think that's the bottom line. You have to look at how the cells work, and from there you can decide what to do with it. So the functions of stem cells, the huge part is anti-inflammatory. So mesenchymal stem cells has been demonstrated incredible anti-inflammatory effect. And as you know, diseases, chronic illnesses,
inflammation is the word.
Or aging process is all tied to inflammation. So when you can calm the inflammation, you can really allow the body to go into the regenerative process. And then second, really huge part is immune balancing. The immune
reactivity.
Immune regulation, right? So you are allowing the immune system to calm down if it's overactive, and to boost the system if it's underactive. And then there's some other really cool properties like anti-fibrotic properties. And I've seen that over and over again. I've seen that in COPD, liver cirrhosis, in nodules in the thyroid or testicles, or Peyronie's, curvature of the penis from the plaques.
Just had a patient
breaking
with that.
down scar tissue. It's powerful. And we don't have anything in medicine that can do that at this
No.
point. So, I mean,
And stem cells help that.
Yes. How fun is that, right?
Okay.
So you can actually break down scar tissue. And they can also promote angiogenesis, so new blood vessel formation. So many diseases, right? If you bring more blood circulation, now you can help regenerate. And it does the tissue no good to have new cells with no blood supply.
Right.
So for the heart, for really anything, you can generate more blood vessels. And then you can, there's anti-cancer properties. So the cells have been shown, mesenchymal stem cells have been shown to secrete certain ligand to trigger programmed cell death in cancer cells.
Wow.
Yeah.
So why are we not using it more with this epidemic of cancer that we're having?
Well, I think that what they call the big C word is a little bit of a taboo subject. However, we can talk about research because there's plenty of research from all around the world using mesenchymal stem cells to treat various types of cancer. And there's been very promising results. So the anti-cancer properties, there's also antimicrobial properties. Besides boosting your immune system to fight microbes, it can also secrete antimicrobial peptides, directly killing microbes. And it can also provide something like mitochondria transfer, which I think is super cool.
Fascinating.
Because imagine these young cells from the umbilical cord having very vibrant, fresh mitochondria. And these new cells getting into the body can kind of spit out the mitochondria either into space or put in a vesicle to fuse with your cells and elevating the energy, kind of life force of your cells. So everything becomes more forceful, right? As far as regeneration. And it can also salvage damaged tissue. So there's systemic benefits and there are local benefits. Of course, can trigger your local stem cells to go into regenerative replication. So if you look at all these aspects of how the cells work, then you want the systemic benefit, right? You want the inflammation to calm down. You want your immune system to come on board. So for me at our clinic, one of the keystones of stem cell therapy is IV stem cell therapy.
IV stem cell
exactly.
therapy. Okay.
Because what I'm doing really is what the cells were doing in the body before. The cells were hovering around the blood vessels waiting for signals.
Right.
And then they would squeeze themselves into the blood vessels to find where the signals are at. So if I put them into the bloodstream, right, I'm really doing something similar to what the cells were doing in the body before anyhow. So then they will find their way to where they're needed. So it doesn't matter where your problem is. The cells will be attracted to those signals. But of course, if you have a lot of injury, a lot of inflammation, and there are only this much cells I'm putting in the body, they're going to be diverted, right? It's like an army that's divided into many battlefronts. So then it's going to be harder to fight battles. And that's why there's dose-dependent
stem cell therapy.
treatment.
Okay.
So you want to calculate how many cells you need by just how much damage you're trying to fix.
So I've heard about IV. Is IV the most aggressive form or the most
I think is the most comprehensive
form?
Yeah.
Okay.
I have helped people even with chronic knee pain, right? Chronic rotator cuff injury without touching those joints, and they recover.
Get better.
Yeah. Plantar fasciitis. So those are the musculoskeletal. A lot of people think, oh, you have to put the cells there.
Right.
Apparently not, because I've had great success just by putting it through the IV route.
Through the IV route. Yeah. Because I think is there intrathecal or within the spine stem cell therapy? That will be
for doctors who are willing to do that.
Okay.
I don't do that in clinic.
Okay.
You do have more risks. Yes, you have more cells directly into the spinal canal, and that can flow through and into your brain, but that does pose more risk. That may not be necessary because we do something called intranasal. You can inject stem cells through the intranasal route, or you can use exosomes intranasally. I think that's a much safer way of delivering cells into the brain. Besides, we also use something called mannitol pre-infusion to open up the blood-brain barrier. So when we actually infuse stem cells,
so there's a technique to all of this.
Yeah,
you can't just go and.
So
what about the beauty? Okay, not to get super light now, but what about like the beauty treatments of PRP and exosomes? I've actually had facial exosomes done. And I like it. But what's your thought on all the stuff being applied topically?
Yeah, I think they're great. You do want to regenerate everything underneath.
Yeah.
But topical, breaking down scar tissue, right? To release wrinkles, to help resurface, basically improve collagen production, decrease inflammation, promote the regeneration, building more skin cells, newer, fresh, and healthier tissue. So definitely, I think they're very, very
powerful,
a wonderful tool.
Okay.
However, I'm still a huge fan of IV stem cells, because what about the fat pad underneath your skin, right?
Yeah.
What about the ligaments and the muscles? If you don't address those atrophy and sag, now you've got perfectly smooth skin, but
it's still
just
sagging.
a little sagging.
Gotcha.
Yeah.
Okay.
So if you really want true youth and rejuvenation, you want to go from the inside out. But the outside, you may need a little bit more, TLC,
right?
Because you get more damage,
right,
by being exposed to this toxic environment.
Is so interesting. So let's talk a little bit about what you're seeing in clinic. Like, what is the patient coming in and asking for by the time they ask for stem cells? What is the average person looking at? And then I kind of want to dive into some of the conditions that even we see in practice where we get stumped or we kind of hit a roadblock, and see if you actually see some improvement there. But talk to me a little bit about your, what's happening in your clinic.
You just reminded me of, because I've trained a lot of physicians and they come to my course. I remember there's one time I was going through the different organ systems and the different clinical research, and my staff was telling me the sounds the doctors were making. They were like, whoa, wow. They were just shocked. Yeah. Because I think in their mind it's like, oh my God,
this is possible.
This patient I have that I haven't been able to help. Now I just see they've done research on this. This actually helps. So it's really powerful to go through all these evidence. So in my clinic, people basically who have tried everything most of the time.
Right.
Unfortunately, you and I are both trained in traditional medicine, and it's very drug oriented.
Yes.
A lot of times it doesn't really address why the disease happened in the first place.
Right.
So it targets how we can relieve symptoms. And that brings about a whole other, a slew of potential problems. Right. Because we're it's like throwing a wrench, and this intricate system.
A system that communicates with each other, a system that is so biologically and physiologically complex.
Yeah. That's
you
why
can't
you
Band-Aid here and then Band-Aid here and expect the two not to communicate with each other.
That's why you have these powerful side effects.
Right.
They're very, very severe and frightening sometimes. And I always said, if stem cell therapy has even one of the severe side effects of any of the FDA approved drugs, we would have been shut down. But it's so safe, and it's also gentle on the system. But as far as going back to what it has, been helpful for, and really from head to toe. So when people come to me, they've already tried, all the traditional approaches.
Right.
So let's say people with diabetes, blood sugar. I've had people even doing biohacking. Some people have done, everything the traditional medicine has to offer, and then everything the alternative medicine has to offer. And still the blood sugar was not budging. And then they come in, they really want, to do some, help with regeneration.
Right.
And lo and behold, there goes, the blood sugars start to come down. And I had somebody with lymphoma also tried everything and tried alternative treatments for over 4 years, and then came to our clinic and did one stem cell treatment. The white blood cell count started to come down, first time in over 4 years.
Wow.
And the second test coming down even further. I mean, he was ecstatic, and not just coming down, but the energy level, the immunity, the kind of, vibrancy
Vitality,
he was able to notice.
Yeah.
Yeah. So, but people come to me, all kinds of
conditions.
So musculoskeletal, autoimmune.
Let's talk about cancer for a second, because I feel like that's a big one. And then
you have to go there, huh?
I'm so curious.
You're fearless.
I'm so curious. I do want to talk about cancer. And then I do want to talk about kind of cognitive health, brain health, mental, like that, because that's such a problem. I think these are two big epidemics. That's why I want to go there. I feel like these are two very big epidemics. First, it was impacting maybe somebody over 40 or over 50, but now it's a conversation for even our teenagers and young children. So what's happening with cancer in the world of stem cells? What are we seeing? Is it an option for something like breast cancer, which almost, I don't know what percentage of women today face it, but it's pretty big, or for prostate cancer in men, or for any of the other solid type tumors? Is it an option?
There's actually a little bit of controversy when it comes to cancer and stem cells, because there were concerns about cancer possibly being promoted, basically cancer growing more
of the bad cells.
Yeah,
right.
Growing into even more virulent or larger quantity, because you're putting cells in there that promotes growth.
Right.
However, people need to be very clear about what kind of cells we're talking about, because if we're getting cells from your own body, that's where the vast majority of the evidence come from of the cancer promoting properties of stem cells. Because your own stem cells, even though you love them, you think your own, everything is great within your body, but you have to realize you have aged.
Right.
We all have aged, and by the aging process, you have lost certain type of intelligence within the cells. They're losing capabilities, including abilities to recognize cancer, because the research, for example, one research was very, providing this resounding evidence when they put umbilical cord MSCs next to cancer cell versus putting fat-derived MSCs next to cancer cell. The fat-derived, of course, is from an adult, right? Umbilical cord from early tissue. So when you put them next to cancer cells, both in a petri dish and in a live animal's body, in both cases, the fat-derived MSCs made the cancer grow, and the umbilical cord-derived MSCs make the cancer shrink and go away. And this is to glioblastoma, right? Very virulent form of cancer. So you have to look at what form of cells you're using. So would I recommend somebody use their own stem cells if they have any concerns of a family history of cancer or recent history of cancer? I would say please don't do that. However, the evidence is overwhelming when you use early umbilical cord derived stem cells that is actually anti-cancer. So initially I didn't, I got caught up in what people were saying, you need to avoid, until I looked at the evidence much more closely. Then I realized, okay, it's actually
the type of
I'm actually going to help people. Are there risks? There are always risks in life. It will be foolish as a doctor to not protect yourself, basically, because cancer happens all the time with or without stem cells. So you need to, basically allow the person to understand that that's a possibility. Is that a possibility? Well, maybe there is a remote possibility using umbilical cord cells, although I have yet to see research showing that. Right? There's no evidence in a human that these umbilical cord cells are actually going to promote cancer. The overwhelming evidence is that they're actually anti-cancer.
Interesting.
So whether or not it's for any specific type of cancer, I think there are different studies on different types of cancer, and they've shown a lot of benefits. Breast cancer, pancreatic cancer, there are different forms of cancer, solid tumor or blood cancer. They have shown benefits.
Have shown benefits.
Yeah.
So. And what about glioblastoma? Have we seen benefits with that?
I don't know.
Such a lethal,
the top
is
of my
there?
head.
So if someone's watching us and they have someone they care about who's dealing with cancer and they've tried a lot of things, is there a resource for them to go to learn more about stem cells and cancer?
Well, Well, I have a not very long video about stem cells and cancer specifically on YouTube, so people can look that up. Just put in cancer. Joy Kong, stem cells, it should pop right up. So I go through the evidence, pro-cancer, anti-cancer, the controversy. However, when it comes to using stem cells, when a patient has cancer, we've done that. We've actually just a very recent case about 2 weeks ago, one of our doctors actually drove over to San Diego to deliver the treatment to a cancer patient who is in Kaiser, basically dying. There was nothing that can be done. She was lethargic for a few months, barely talking. And Kaiser had nothing to offer.
Right.
They just said there's absolutely zero therapy we can give you. So they have a policy. If they have nothing to offer a patient, then they are allowed to pursue alternative forms of therapy. So the family were desperate and they wanted the treatment. So we delivered it. And within 1 hour, the color was coming back to the patient's face. And not only that, she started to get feisty. She was saying she didn't want something on her arm. She started just talking. Her personality was coming back. And now, she's been eating and she's living her life.
Yeah.
So, I mean, that's when somebody was dying. But of course, I talked about the lymphoma patient, how the number was decreasing because you're elevating your immune system.
Yeah.
You're able to fight the cancer better. Not to mention these cells actually have direct anti-cancer properties. So the combination of boosting your life force and your ability to fight.
That's a great way to think about it. It's not necessarily a cure, but it's boosting your body's ability to hopefully, at the end of the day, shut these cells down.
Right. And that's pretty much the only thing we can talk about right now.
Right.
Because just like supplements, right? You can't talk about diseases.
Right.
But you can boost.
You can
always
boost and augment the body. Okay, let's flip to mental health, cognitive health, brain injuries. We have a problem. What is the role of stem cell therapy in this massive epidemic impacting children, teenagers, adults, seniors, as we're seeing the decline of our brains?
Yeah, unfortunately, there hasn't been a lot of research on brain conditions and stem cells. There's just not enough. There's one animal research that's really cool about addiction, alcohol addiction. And they used animal model and was seeing dramatic decrease in addictive behavior in alcoholic rats. But for humans, I think there's just not enough
we're not there yet.
research.
Yeah.
But part of the beauty of being educated as doctors is that we can conduct deductive reasoning, right?
Yes.
We know how the cells work.
Right.
We know what happens in mental health. And just like addiction, neuroinflammation is part of the underlying mechanism for a lot of the problems.
Things, right.
So the stem cells, because it can calm inflammation, because it can balance your immune system, which also has a lot to do with mental health, and because it can help promote tissue regeneration, and it's very neuroprotective. It actually secretes different molecules that have been demonstrated to have neuroprotective properties. That's why it's so helpful for after stroke or a traumatic brain injury. So, or even Alzheimer's.
Right.
So knowing what they can do for the brain, we can deduce that it may be helpful, but there hasn't been enough research
behind it.
Yeah.
Okay, let's go a little bit lighter and a little bit maybe more fun. What about skin and hair and, wrinkles and all the stuff that both men and women today care about when it comes to our aesthetics? Where's the role of stem cells for that?
Well, I definitely think if you really care about being youthful, you should look into IV infusion of stem cells. Yes. And I've been doing that every 3 months for the last 8 years.
Oh, wow.
Yeah. And I can show you pictures because I'm 53. I will show you pictures of when I was 43 of what happens, to my skin and to my overall, just the facial fullness and the youthfulness.
Yeah.
Because even though I didn't want to admit when I was 43, when I look at the pictures now, I was like, oh my goodness, I was aging. I didn't know I was aging at that time. I just thought my camera was no good. The lighting was terrible. Yeah, but now I realize it's
stem
me.
cells. Right, where's your clinic? So when can I get in?
So you want to rejuvenate, right? You want to replenish tissue from the inside out. On top of that, you can do procedures to help with the regeneration of your skin. And you can definitely do either stem cell injections. I was teaching doctors, no, you want to inject the cells into the skin because the cells are very big. If you just put it on surface, even if you microneedle, there are going to be very few cells that actually get inside of your skin. But if you inject, they're there. They can migrate. They can, diffuse.
Do their thing.
So they can go to places, they will sit there and start to secrete all these regenerative signals.
Gotcha.
But you want to inject cells into the skin or the scalp, and then you can do microneedle on the surface. But if you don't want to do that, some people are afraid of needles, and it is a little bit painful, have to admit. So you may not have to. You can just use exosomes because they're nanoparticles. They go across the skin.
Can you
right away
microneedle those into the skin?
Yeah, so you can. Okay. So we have a product called Chara Exo SST. It's only for topical use, and then we can dilute that. We can basically dissolve this lyophilized exosomes with this liquid that contains hyaluronic acid, GHK copper peptide, and also biotin, right? All very beneficial for skin regeneration. You can mix the two together and do this incredible facial treatment. So because the hyaluronic acid will produce a little bit of viscosity, so you can put it on your skin or scalp and do microneedle, and then they will penetrate much deeper once you are doing microneedling. But microneedling also is going to produce all these signals to repair and regenerate. So your cells will come alive much more. So that now you have the signals from the exosomes and the copper peptide and etc. Now you can work synergistically together. So that's very effective, and it's not very painful. It's actually, fairly.
And hair loss, where that's a big complaint for so many people.
Yeah.
Where's
I'll be remiss not to mention the IV route for hair loss, especially if you have autoimmune or infectious origin. Infections sometimes can trigger autoimmune issues. So people have clumps of hair coming out, and I've treated people with those type of hair loss, and they all of a sudden they stop losing hair. They barely are seeing much hair loss when they shower. Now they have a chance to actually grow their hair back. So you want to address your system, right? You always have to look at where's the problem. But if you want to target locally, you're always going to get more signals from the cells if you put the cells or the signals from the cells, which are the exosomes, when you put them just in the local area. Topical
so
application.
You're saying like topical and IV
will be the
power punch.
That will be the
I love that. And then best. Okay, last one, weight loss.
I don't know if there's direct evidence for weight loss. However, I've seen people with stem cell IV infusion. Usually they have so much more energy and so much more this feeling of a vitality. Previously, they may be almost incapacitated by pain or just sluggishness. All of a sudden, they feel like they feel good. They're able to work out, and all of a sudden, the weight just comes off.
Just because their overall life force. I love that you use the word life force. We use that all the time.
Oh, really?
In Chinese medicine, like qi, right? Or prana, or this like energetic field, whatever we want to call it, improves. And that in turn allows behavior to change.
And along that line, I actually think stem cell therapy is a form of energy therapy. It's not, we're not injecting molecules, right? It's not a pharmacological, it's energetic, because I'm injecting DNA, and the DNA with its intelligence is sending signals through that intelligence. So intelligence is a form of energy, right? So you are infusing. It's the first time in human history that I'm injecting intelligence into the body,
back into the body
of my patients.
Wow, that kind of blows my mind a little bit, to be 100% honest. That's so incredible. Where is? I'm afraid to ask this question, but I'm going to do it anyways. Where is the medical community when it comes to stem cells, and where is the pharmaceutical company when it comes to stem cells? Because oftentimes they will try to monetize or turn a modality into a prescriptive modality. So tell me what's happening in the landscape of the place that we came from, traditional medicine.
It's interesting. One funny part, you were mentioning pharmaceuticals. So they definitely want to capitalize on this. And what's funny was that they're so stuck in the traditional pharmaceutical
line of thinking.
That they are trying to replicate cells as if they're making a drug.
Right.
But cells don't live forever.
Right.
You can't just make the drug and standardize them in a way that, because there's a company that were trying to get FDA approval. They were using the same line of cells, right? So you keep replicate these cells. You think that now I have control because these are good cells.
Right.
So when I did my first group of study, phase 1, it's great.
Right.
It got good results. And then they do phase 2. But you keep replicating these cells, right? They don't just keep growing and with no changes. These are biological systems that they have a finite lifespan. They can't just replicate forever.
Right.
These are not, like a particular molecule. These are complex systems. So they start to degrade. And then by phase 2, whoops, didn't work as well. By phase 3, it failed.
Yeah.
So it's funny, right? So if you keep using your conventional way of looking at this new way of doing medicine, then you probably won't do very well.
Right.
So there are companies who are capitalizing on it, but you could get products from the cells. So you can allow the cells to secrete certain molecules, and then you use those. I'm talking about exosomes in particular, these little packets that contain probably thousands of different kinds of molecules. You can use that to help with healing. But that's still, how do you standardize it? So I think the FDA is having trouble regulating
They're going to.
Because it's a dynamic system.
Well, it's the same problem they have with supplementation or Chinese herbs or any of these modalities, because all of these are based on what does your particular body do or organize around this particular herb or supplement. You can't use the same philosophy like drug A creates reaction B, therefore it works. A lot of like the herbal literature and the supplement literature is much more around augmenting, providing energy to the body in different ways. And that's going to look different on different people. So it's very difficult to standardize it across the board. So it's almost like the field of energy therapies, if we're going to throw stem cells into that too, I would throw supplements into it. I would throw acupuncture into it. I would throw craniosacral therapy, all these different things I would throw into this bucket of energy medicine that needs a different form of research to kind of prove effectiveness,
And I do believe that the conventional way of breaking everything down to the really granular part of A to B, relationship of A to B, it ends up driving you crazy, because I don't know if you've seen those doctors trying to explain pathways of drugs.
Oh, yeah.
And you're trying to determine what this drug eventually does to this particular, this behavior.
Right.
And this behavior is affected by all these different chains of
things,
right?
Yeah.
And then this drug could be increasing this neurotransmitter, and this neurotransmitter will decrease the other neurotransmitter. And then, and then you have this web. So you are driving yourself crazy, and you can't figure it out, because it needs to be a system approach. And I do think that AI, artificial intelligence, at this point is probably going to help us decipher these complex relationships that our human brain cannot comprehend. I think that will be the next generation of where medicine's going. Yeah.
Gotcha.
But coming to your question, back to your question about how the medical community is receiving stem cell therapy, I would say they're always open-minded and kind of brave doctors, brave souls who want to embrace new therapies. There are always people who are pioneers, who are willing to look beyond the box.
Right.
But majority of people, the doctors, still have their blinders on.
Yeah.
I would say 90% of doctors, unfortunately, right now are still practicing very old medicine.
Right.
That doesn't work very well.
20-year-old medicine,
Yeah,
at least.
it doesn't work too well. That's why so many doctors are quitting, not to mention that they're very poorly compensated. Their ability to make a good living is getting more and more diminished, where the stress just keeps mounting because they're not effective.
Yeah.
But still, they're locked into the system, and they don't even want to look outside. And what's interesting is that this whole generation of providers on block is going to be left behind. So this whole other way of doing medicine, these doctors are going to form the new wave of medicine. The other one just going to gradually die off. Yeah, that's it. Yeah. So then either you come on board, join the new wave,
or you'll be a part of the old one. Yeah, no, that I was telling you earlier, that's my mission. I think there needs to be a new way to do medicine. I think a lot of us have to come together and create a new system, whether it's starting with medical homes and then having novel specialty care that actually makes a difference. I think this is the future. And I think for anyone to continue to point fingers, I've come a long way from being called a quack in my early days, so, we've come a long way from that, which is fantastic. But I don't think anybody in the conventional medicine academic community can point fingers anymore, because it's obviously not working, and the consumer, the patient, is desperate for alternatives, while the doctor is desperate for a way to express their skill and their talent and their creativity, because healing is a gift. And in the current system, doctors are not allowed to express or to use that gift. And that in itself is incredibly wrong. So I see the future. I can see it.
And I think patients are the ones that are driving this wave.
Totally.
Because I
100%.
have,
Yeah.
multiple doctors approaching me saying, Dr. Kong, I have a few patients. They all are trying to get stem cell therapy. They've all asked me, and I don't know what to do. I don't know how to do it. Can you teach me? So they would not have come to me on their own, because they realize these people are asking for. They have to catch up.
Right.
So because people are desperate.
They're desperate. Speaking of which, is stem cell therapy expensive?
The range is quite a spread. Okay. It's between $5,000 to $50,000 within the U.S. and overseas. So that's kind of there are companies probably can charge more, but that's the range depending on what you're doing, right? Are you just doing a joint injection? Are you doing a facial? Are you doing IV? So, but if we're talking IV treatment, generally is probably, the range is going to be about the same. It's a little bit more expensive, probably, $7,000 up to $50,000. And people think that things are better or cheaper overseas, and that's just not true. Sometimes they're a lot more expensive. It's not uncommon for people to be charged $35,000, $50,000 overseas.
And is the quality maintained overseas, or how?
The problem is that overseas, the reason that they are overseas is because they are trying to avoid certain regulatory constraints within the U.S. Because in the U.S., if you start to grow the cell expansion, that means that you are changing the cells in a certain way, which is true. The moment you start to grow the cells will make changes, such as genetic expressions. They go down different pathways, and they start to secrete different types of growth factors and signals, and they can senesce, right? They can get older, they can even become inflammatory, and then they can cause more rejection once they start to express different proteins on their surface, because they're gaining function, because they're going down a particular pathway. Now you have more chance for rejection. So that is the problem. And this probably is part of the reason FDA says the moment you start to expand and grow the cells in culture and you want to give it to people, well, now you have to do clinical studies, because now we think you're making a drug, because so many things can change. So we need to study it. But all these companies are saying, no, earlier research are using this large number of cells, so we need to use this large number of cells, and we can only do it if we grow the cells, and we have to do it overseas. However, what's happening in the U.S. is that because of the constraint, all these doctors are using cells that are not expanded. So they are just the original cells in the tissue. So once you carefully separate them out and you cryopreserve them, that's just the way they are. They've never been grown in a culture. So they preserve the earlier characteristics, so they don't have the kind of potential to cause rejection, and they have not gone through genetic changes. So there's very little side effects, especially when we're talking about MSCs, which is very immune calming. But if you go overseas, you think you're receiving 100 million, 200, 300 million cells. But how many of those cells are actually still the original MSCs? Not very many, because the cells have a tendency, that's the characteristic of a stem cell. They divide asymmetrically. They divide into, if you imagine one cell divide into one of itself, and the second one is the daughter cell that's more differentiated. And now you have two cells, right? And that original cell will divide into a copy of itself and a daughter cell. And the daughter cell can only divide into daughter cells. It can't go backward. So now you've got 4 cells with only 1 stem cell, right? So then you keep going. Gotcha. Now you got a soup of differentiated cells that have been changed, that it doesn't have the original characteristics, and you give that to people. It can work. People have achieved some good results, but you also have increased the chance of rejection and side effects. And that's what we've seen.
Fascinating stuff. I could talk to you all day about this, and there's more we wanted to get into, but we are out of time. But thank you so much for being here. I do want to, before we leave you, I ask every guest this question. You talked about energy. You talked about life force. What maintains your life force? What keeps you whole?
That's a daily process. So
that's a great answer right there. It's a daily process.
Yes.
It's not something that's a destination, but keep going.
It's a pursuit.
It is a pursuit for sure.
So eating healthy is really important. Don't put junk in your body, and move your body in some ways. I'm not always, perfect in that.
Right.
Some days get so busy and I forget to exercise. And then, some kind of centering process, right? Whatever you do, meditating, going out for a jog, whatever you have to do, hug your pets. And of course, for me, I love stem cells. For me, it's one of the greatest hacks because it's so easy, so fast.
Yeah.
And I only have to do it a few times a year. So that's my great hack. Because I'm actually not very consistent. Sometimes I slack off, like supplements I take. I rarely take anything a long time because I don't remember and I get annoyed. So, but there's something that's really simple. And then, that's my big tool for maintaining
your hack.
Youthfulness and vitality.
Stem cells. All right. Well, I've learned a lot today. So thank you so much for educating me. I'm hoping any of you watching or listening know a little bit more about stem cells. And if you are thinking about it, you have a little bit more guidance now on how to go about it, what to look for, the questions maybe to ask. Dr. Kong, if anyone wants to connect with you, what's the best way for them to do that?
Yeah, so my website is joykongmd.com. Or my Instagram is Dr._Joy_Kong. So Kong is Kong. And if anybody's interested in taking a deep dive in stem cells or any other modalities of healing, I do have a podcast, the Dr. Joy Kong podcast. Amazing. And then I have a YouTube channel, just Joy Kong MD. I have lots of videos. I probably talk more about stem cells and different aspects of stem cells than anybody I know. So that could be a great place as a resource for people.
Incredible. Well, thank you for being here and spending some time with us today.
Thank you so much for listening and watching today's episode of Whole Plus. Be sure to share this episode with your friends and family. And if you haven't already, please take a moment to subscribe to this podcast on YouTube or click the follow button on Apple, Spotify, or wherever it is that you get your podcast. And don't forget to follow me on all social channels at Dr. Taz MD. Until next time, stay healthy and stay whole.